Symptoms for allergic reactions involve trouble breathing, swelling of the tongue or face, fainting, and dizziness. The actions for helping someone who is having an allergic reaction include checking the scene, calling 911, and telling someone to get the AED. If they have an epinephrine pen, you hold the pen in the middle, not touching either side. Remove cap safely, thrust into the side of the person's thigh. Remove the pen and rub around the injection site for approximately 10 seconds. Note the time of the injection and dispose of the pen properly.
Do you have a peanut allergy? There are peanuts in this. Do you have an EpiPen on you?
Actions for helping someone who is choking involves taking one hand and making a fist. Put your thumb in slightly above the belly button, grab the other fist, and thrust into the chest cavity. You repeat this action until the object comes out or he or she stops responding. You call for help, check and see if they need to be given CPR, and stay until help arrives.
Oh no, are you choking? Okay, let me help you.
To clear the airway of a pregnant woman or obese person, position your hands a little bit higher than with a normal Heimlich maneuver. At the base of the breastbone, just above the joining of the lowest ribs. Proceed as with the Heimlich maneuver, pressing hard into the chest with a quick thrust.
Okay, let me help you.
Symptoms of someone who is having a heart attack is an uncomfortable chest pressure, squeezing, fullness or pain, uncomfortable feeling in the upper body, shortness of breath, or sweating, nausea, or lightheadedness. Actions for helping someone who is experiencing a heart attack involves keeping the person calm, call for help, and get the first aid kit and the AED. Ask the person if they are allergic to aspirin. If not, provide the aspirin. Be ready to perform CPR if the person becomes unconscious.
Oh gosh,
Are you okay? You don't
my
look so
heart's
good.
getting tight.
You might be having a heart attack. Come sit down. The scene is safe. Somebody help! Please, somebody help! Go get the first aid. Go get the AED.
Oh, it really hurts. Here, take some aspirin.
Actions for helping someone who has fainted is have the person lie down, look for obvious signs of injury, and call for help if the person is not improving.
Oh, can we put down too heavy?
I got up too fast. I don't feel very well.
Are you okay? Oh my gosh. Hey, you're okay. You fainted. I called for help, and help is on the way, and I'm going to stay until they arrive, okay?
Okay, thank you.
Actions for helping someone who is diabetic is if the person can sit up or swallow, give them sugar. Help the person sit or lie down quietly. Call for help.
I don't feel so good.
What's wrong?
I feel very lightheaded.
Are you diabetic?
Yeah.
Oh, here, I have some juice. Sit here quietly. Let me get some juice. Here, try to drink some of this while I call for help.
Some symptoms of someone who is having a stroke is numbness or weakness, confusion and trouble speaking, trouble seeing, trouble walking or dizziness, and a severe headache. The actions of helping someone who is experiencing a stroke is to check the scene, call 911 and get AED, note the time of the stroke, and be ready to provide CPR if needed.
Hey, I have a question. Are you okay? You might be having a stroke.
I think something's wrong.
Okay. The scene is safe. You call 911. You get the AED. Oh gosh, it started at 2:15. Okay. We're asleep.
Symptoms of someone who is experiencing a seizure is loss of muscle control. They fall to the ground, they stop responding, and have jerky body movement. Actions for helping someone who is having the seizure is check the scene, call 911 and get AED, check to see if CPR is needed, stay with the person until help arrives, and if there is no obvious sign of injury, roll the person on their side.
Turn the lights on. I think she's having a seizure. Oh, pillow. Place this under her head. Okay, I'm gonna lie you on your side. Response. Okay. You just had a seizure. I'm gonna stay here until help arrives. Stay calm.
Symptoms of someone who is in shock experience feeling weak, faint, or dizzy, nauseous or thirsty. They have pale or gray skin, restless, agitated, or confused, and cold skin to the touch. Actions for taking care of someone who is in shock is you check the scene, call 911 and get AED, lie the person on their back, provide warmth by covering them with blankets if there is any, and check if CPR is needed.
Hey! Oh God. Ow. Oh gosh, I'm feeling kind of dizzy and weak.
Okay. Oh, you're cold to the touch. You might be in shock. Let's lay you down.
Oh.
The scene is safe. I'll call for help. Help! Help! You get a first aid. You get an AED. Call 911, please.
I'm so dizzy.
I'm going to cover you up. I'm going to wait till help arrives.